emerged in 2010, the African Institute of Development Policy, also known as AFIDEP, was named the UN Population Award winner for 2023 in the institution category for its evidence-based approach and collaborations with governments, civil society organizations, and international partners, leading to impactful programming and positive outcomes in areas such as family planning, maternal health, adolescent sexual and reproductive health, and African population dynamics. And that's the conversation we want to have right now. And joining me for it is Dr. Rose Oronje, who is the head of Kenya Country Office, AFIDEP, and is here with us. And we'll be shedding some light on the award and most importantly, how to achieve positive outcomes. Good morning and welcome so much.
Good morning.
Congratulations are in order.
Thank you very much.
So maybe let's start with that. You know, what does the award mean? And what is it about?
So the UN Population Award is about recognizing efforts of individuals and institutions who have made substantive or outstanding contributions to solving population problems.
Yeah.
And so AFIDEP is recognized as an institution that has contributed particularly to supporting African countries in putting in place policies and programs that enable us to harness our very youthful population for economic growth.
Okay, so you know, many might ask, so what does this mean for Kenya and Kenyans in general?
It's a recognition of Kenyans' efforts. If you think that AFIDEP was established here many years ago, as you said, in a garage in Nairobi.
I know, that's an interesting story.
Yeah, and so started off with one person who believed in the fact that Africa, we can drive our own efforts. And when you think about population and development, you can't develop without thinking about your population.
Yeah.
You know, for you to put in place policies for schools, for hospitals, you know, for roads, you need to know about your population and monitor how it's growing.
Yeah.
So AFIDEP was set up to provide data and evidence that helps governments improve on how they plan, the decisions they make, the investments they make around development. But of course, we are talking today about the Population Award. So I'll focus more on population because we work beyond population. We also work on governance issues, on environment issues. And I know they all somehow come around population.
Yeah, and it's interesting because, you know, you talk about the fact that all this is a result of population. So where are we in terms of African population dynamics?
So that's a very important question because the African population structure is actually at the center of Africa's development. And so our population is very youthful. We have a pyramid type of population structure. That means that at the base, where we have the young people below 19 years, we have a very huge population. In fact, when you think about Kenya, Kenya's population, if you look at those under 19 years, it's about 50% of our population is under 19 years. Now, if you take that to 24, because we know sometimes by the time you're 24, you're not even working.
Yes.
So if you take that to 24, it moves to 60. 60% of population is below 24 years old. Now, those are dependents. Those are people who are not working, they're not productive. And Kenya's population structure is the same as Africa's. So many African countries are like that. What that means is that we are struggling to develop because only a small percentage are actually working and driving the economy. And, well, I should also bring in the issue of unemployment.
Yes.
So there are many of us, even in that age bracket that should be working 25 to 50, they're not working productively because we're not generating jobs.
True.
You know, so that pyramid kind of population structure for Kenya and for Africa means that it's making development very hard. You know, and that's what contributes to issues like high levels of child deaths, you know, under 5 deaths. But also, I mean, when you think of economic growth, Africa often gets hit so badly because economic growth is also slow, and largely because of our population structure. 50% are not driving the economy, 50% are dependents.
But does governance have anything to do with it?
Absolutely, because we have to be, as Africans, we have to be very strategic in thinking about how do we turn these around. And that's part of the reason why AFIDEP has been recognized for this Population Award, because we have been conducting modeling, analysis of data for different governments, actually many governments across the region, looking at that data and thinking with this population structure, you know, that is very big at the bottom. We call it a youthful population structure. What should Africa do to transform? Because you're not going to change our economic growth if we remain with that structure. And so what AFIDEP has been doing is to look at data, but also look at what can we do to change this structure? Because we need to change the structure from a point where the bulk is not at the bottom. The bulk is in the middle, where the majority are working. So we need to have many more people between the ages of 24 and 55. If we have that bulge in the middle, then that will drive our economic growth. And we have seen that work in this country is called Asian Tigers. I know many of us have heard about them. Many of them were where we were in the 60s, were the same level in many countries in Africa, were the same as the Asian Tigers.
The likes of Singapore and
absolutely. And they managed to change their population structure from a very huge bulge at the bottom to a huge bulge in the middle. And that has really been the momentum that has been driving the economic growth. So that's where we want to go.
Okay, but I just want to be, well, should I say the devil's advocate? You know, most of the times Kenya is compared to such countries like Singapore. But then let's not forget, it's their systems that are working. Are our systems working?
Ashley, I always say that the biggest challenge in development is addressing the systems. Actually, the elephant in the room is always the systems. Because there are things we can do that are not the systems. We can focus at individuals, and change so many things at individual level. But if your systems are not working, if your policies, the structures are not working, then there's a problem. Now, let me get back to the issue of population. We have, compared to the Asian Tigers, yes, we have focused on reducing fertility. Fertility is the number of children women can have in their reproductive age. Yes, our fertility has been going down. But have we been strategic in ensuring that it actually goes down to the levels where we can have that bulge that can drive our economies? We haven't. And reducing fertility is complex. It's not just asking women to take contraceptives, right? That is one of them. But we know that there are many things underlying high levels of fertility, which we haven't addressed. Keeping girls in school is a big way of reducing fertility. But we still have levels where girls, enrollment in school, particularly reaching university levels, those are still low. And disparities in gender are still very low. So numbers of kids in school have increased. Primary level, we are doing quite well. Secondary level, doing quite well. But then when you move out of that to tertiary levels, then you're not doing very well. That is the difference what those countries have done. They have ensured that they're really enhancing people's completion in school, including to tertiary level, so that people have skills that can drive the economy. Africa is still lagging behind on that. So focusing on education, but also importantly, the cultural issues, right? The societal issues. We still have leaders and communities that look at population and large families as really good. And I'm not saying that we should all, stop having children. It's really the quality. So if we have a huge population in Kenya and it's a quality population, it's able to drive the economy, that is so good.
All right. But I'm just curious, because we're seeing countries such as, China, Finland, who are paying their women to actually get pregnant. If we reduce our fertility rate, are we likely to get to that point?
So you will remember that China had very drastic population policies in the 80s, I think. There was a point where they were just having people have one child, isn't it? And that enabled them to have the bulge I was talking about in the middle, where you have the majority of the population working to drive the economy, and same as Singapore. And that is how those countries have grown. The challenge at that point is that when you get to the bulge, because population changes over time, so that bulge becomes old. Right? And yet at the bottom, you are now having very few children. So China for a long time had just one child. So the bulge was working. The bulge continued becoming old, but that bulge was having one child. So when that bulge transitions to the elderly, which is where they are, now they have very few people in the working age.
So it's like an inverted pyramid.
It's like an inverted pyramid. Now, we need to learn from that. But we are not there yet. We still have a big bulge here. So we need to deal with this. We need to get to a point where we reduce fertility. We're not saying go to one child, but we need to get to a point where we reduce fertility to maybe about 2 point something. Right now in Kenya, the recently released Kenya Demographic Health Survey showed that our fertility is at 3.4. That means women are having about 3.4 children in their reproductive lifetime. That is good, but we still need to go low for us to get to a point where the bulge can actually move to reproductive health.
So what's low? Maybe 2?
Low is about 2. 2.1, 2.5 is low enough to drive this, so that we don't get to China where we now have the bulge there, and then within 20, 30 years, the bulge is old,
yeah,
and then there aren't people to actually drive the economy because now you're busy taking care of the elderly. And that is the problem those countries are facing.
Okay.
So we need to think about that even as we governments work very much to reduce fertility, it needs to go to levels where we're also thinking about the future. We won't have the China problem soon in Africa. I mean, the bulge there will continue growing our population for the next 70 years.
Okay.
So when you think of the China problem, for it to get to Africa, it will probably be 70, 100 years plus.
Okay.
Because we have, the people who will drive our population are already born.
True.
Yeah.
They're our future.
Yeah.
That's what people say, right?
Yeah.
The young are our future.
Yes.
But you've talked about a number of issues, fertility, which includes family planning, the fact that we're seeing children not go to tertiary levels.
Yes.
And one of the things that I actually read just a few weeks, I think a few days ago, is that Kenya plans to eradicate issues such as teenage pregnancies by 2030.
Yeah.
How possible is that, considering that we are an African culture, an African country, and we know we have cultural beliefs that we embody.
Right.
And then let's not forget that it's a different generation that we're dealing with.
Right.
How do we stop that?
Right. So teenage pregnancy remains a problem in Kenya like elsewhere in Africa. In fact, when you look at the African numbers, Kenya always looks like it's doing better.
Are you serious?
Than other countries. Because we have the latest KDHS, the Demographic and Health Survey, shows that we have improved from, I think we were 20% or 18% in 2014 of teenage pregnancies. Those are the percentage of teenage girls who have, given birth.
Yeah.
This has gone down to 15% now. So we've moved from the averages of 18 to 20 in 2014 to 15%, which is good. But the problem is that we are not getting to levels that we want. Because even when you look at the 15%, that's an average, isn't it? It's hiding a lot of disparities. Look at counties like Samburu. Samburu has 50% of the girls already childbearing at the age of 18. And so you think of our average being 15, but then counties like Samburu and others have 50%. It means we're also very clear on where we need to intensify our efforts in bringing the fertilities down. Okay. So actually several counties have more than 25%, and so we know where to intervene. Now your question is about what do we need to do?
Is it actually possible?
It is possible.
But there's always a but.
Yeah, there's always a but. Let me speak a bit on what government has put in place, and then I'll come back to our own cultural and social issues that are kind of underpinning this problem. The government is very keen on bringing down teenage pregnancy, and there are various plans in place. There are strategies in place I was reading about. There is a triple threat strategy now that is in place looking at teenage pregnancy, HIV and domestic, is it gender-based?
GBV,
yes. GBV. So that strategy is currently on and being implemented. But the government has also formed various work task forces and working groups at the national level, at the county level, and that just shows you the commitment to this. I guess something that I probably am not very clear about, and is something that we can have further discussions around, is the investment. It's one thing to have policies in place. It's one thing to have committees and working groups in place. It's one thing to even have this triple threat strategy in place. The question is, how much money are we putting in to implement this strategy? As we talked earlier before we started this program, we are very good at having policies, isn't it? The question always comes in, are we putting in the money?
The gap
for the policies,
and the implementation.
And I don't have the numbers in terms of whether we are putting in the money. But when you look at other issues, maybe not this triple threat or teenage pregnancy, but when you look at other issues, we often fall short. Our budgets are often falling short of the commitments we have made. And it's not just not having inadequate budgets, but it's also how are we spending those budgets to drive those issues. So if I come back to the issue of teenage pregnancy, I think on the policy front, on the leadership front, on the working groups we need to put in place at the different levels, those are in place.
Okay.
What needs to probably be prioritized is really looking at the community level. And that's where culture and social norms come in.
True.
Sometimes as an expert in this area, I feel that one of the reasons why we haven't done very well in reducing teenage pregnancy is really cultural issues. And just us not being able to talk about sex, to talk to our children about sex, about the consequences of sex, and importantly, how they can have the information and the skills they need to live healthy and productive sexual lives. Because we're not talking about sex, or sexuality remains an issue that is,
it's a thorny issue. You don't go there. Yes.
And I think that if we are going to make the big progress we need to ensure that more girls, 100% of girls, for me, I want to be at a point where 100% of girls stay in school until university or college level. Because some of us, me and you, are where we are because we managed to get to those levels, isn't it? And so we want to have 100% of girls staying to those levels. How do we do that? We really need to face the problem. It's at the community level. It's at the household level.
And it's true what you said, because, it just doesn't need government and task force. It's a multi-sectoral approach, and multi-sectoral involves even the parents. And the parents themselves have a problem talking to girls. Those who, those who overdo it in terms of even going a step further and introducing young children to contraceptives, which is not really okay. Then there are those who are like, sex education, what exactly are they going to be taught, So it's true, it is a thorny issue, but maybe there's the light at the end of the tunnel, the fact that there is that, I guess, goodwill to get rid of it or eradicate teenage pregnancies and the triple threats that you've talked about. But I want us to move on and just talk about health and enhancing financial health in the country. First of all, how are we? Where are we when it comes to financing health?
So, generally, we are failing. We are
Straight
failing,
up, yeah?
Yes, we are failing because we are not investing enough in health. But even the little we are investing, we are not spending it well. There are challenges with underspending of health budgets at both the national and the county level. But let me go back to the numbers. When I say we are failing, it's because when you look at health expenditure data that we have, just about 48% is actually covered by the government. That is through government taxes and investments. Now, that means that 52% is being covered by others. You should be at a place. Health is a right. In our constitution, health is a right. Each and every Kenyan has a right to the highest quality of health care. It's written. I'm not making this up. But if that is the commitment we have, but government is only investing 48%, what that means is that Kenyans are spending so much we call it out of pocket. When you fall sick right now and you have no insurance, you sell whatever. Some people have sold land, right? That is out of pocket. And out of pocket expenditure by 190 remains very high. For Kenya, is about 24%. And that is part of what is covering the 52% that nobody is covering. So Kenyans are paying about 24% out of pocket to get health care. And then we have the external support, about to 18% donors. And we know that donor support is going down because now we are a lower middle income country, whatever that means. And so donor support is reducing. So that is at 18%. And then we have 10% of private providers, providing health. But we know that also always brings in inequities because private health care is a profit making, And so wherever you go, you have to pay money. And so it's only accessible mainly to the rich. And so when I say we are failing is because we are still failing Kenyans. Kenyans are still facing catastrophic expenses when someone falls sick. And I know you probably have been in many fundraising where you're raising money to have someone paid for treatment or even, pay for funeral costs. I have faced the same things even at personal level where you just see yourself, all your savings going down. It's because we are failing as government to provide services to Kenyans without them going through catastrophic expenditures. Now, I think there is light at the end of the tunnel, because when you look at how Kenya has been investing in health over time, from the time when our new constitution came in, and devolution came in, there has been increments in allocations to health, really moving from about, I think, 7.8% in 2012 of the national budget going to health. And now I think we are at about 11 point something percent.
With the recent budget?
Yes, with the recent budget, that percentage going to health. Of course, when you think of the commitments you have made, we are failing because there is this commitment our government's made in 2001. Maybe you were not born. It's called the Abuja Declaration. It's called the Abuja Declaration, where our government's committed, African governments committed to allocate 15% of their budgets to health. Kenya has never achieved that. We're still very, very below.
So then what do we need to do? Because clearly this is a problem for Kenyans and maybe Africa in general. What needs to be done?
Many things, because one of them is even recognizing that health is a driver of economic growth.
Yeah.
I think that's where we are failing as Africans, because we look at health as a consumer. And that's why when you look at the budgets of different African countries, when you look at the first 3 sectors that are being prioritized, do you see health in those 3 sectors?
No.
Health is never there.
Yeah.
Even in the current budget, health is not among the top 3 sectors. And so health, we have not prioritized health to the level it should be.
Okay.
So even when you think of, like right now, our government is focused on the bottom-up, economic transformation, which is fantastic, But the bottom-up is what wananchi. If you're sick, you can't work, And if you're having to spend all your savings to pay for your healthcare or the healthcare of a relative, then that economic transformation we're talking about will not happen, because health is at the center of this economic growth. But that's what we fail to do as African governments. We haven't prioritized health.
What about the fact that they're planning on introducing more taxes?
Right. So governments need to put in more money into health, like I've said, and that money needs to come from tax, right? Because government revenue is largely tax, isn't it? It doesn't mean that we need to introduce more taxes, to Kenyans. And I'll speak a bit about that, because there is now a suggestion to introduce, to change, I think it's changing contributions to health, 2.75%.
Yes.
There is that. And we recognize that there is need for more money in health, and it's going to have to come from somewhere. It has to come from tax revenue. However, we need to be strategic as governments, because health is a product, poor health is often a product of failures in other sectors. And those sectors are often making money, right?
Maybe elaborate that for a viewer who is watching and they're trying to understand, what do you mean?
Yes, so what I mean is that, and maybe I'll be very recent. Recently, we had a terrible accident at Londiani. A lot of people died. Yeah. Those people ended up in hospitals. That was, the hospitals have to deal with that, right?
Yes.
But what was the failure? The failure is coming from our transport sector. The fact that we are not, managing very well. So that's what I mean when I say that poor health is a result of failure in other sectors.
Yes.
So when you look at even issues around nutrition, where children have malnutrition, the problem is within the agricultural, the food security sector is not really within health. And you said this earlier, health is multisectoral. We need to look at health as, how is agriculture contributing? How is the roads contributing? How is manufacturing and food production contributing? So that's what I mean. So these industries produce a lot of taxes. Can we say, because these industries are also responsible for poor health, can we get some of those taxes to health?
Okay.
That's not too much to ask. Because a lot of the sectors that are prioritized, that drive the economy, are actually sectors that also produce poor health or contribute to poor health. So when I talk about taxation, I'm really keen to see government not introducing more taxes to Kenyans, rather being very strategic and creative on how we use the taxes we already have, the tax revenue we already have.
Yeah.
Like saying, can we get percentages of particular taxes from different industries, from different sectors, to go to health? Because we definitely need much more money in health. So that's what I mean.
Okay.
When I come to the issue of 2.75% of income for those who are employed, I think it's for those who are employed going to health, that is important, because right now the contributions that go to NHIF are really low. And so NHIF is not able to run and provide services for all Kenyans. I should have also talked about the issue of insurance, because insurance coverage means that if I'm covered, when I fall sick, I'm not thinking of selling my shamba.
Yes.
I just go for care because I'm insured. But currently, only 24% of Kenyans, I think 26% from the current DHAs, have health insurance, which means 74% don't have health insurance.
But now, sorry, as you finish your point,
yes.
So then, is there light at the end of the tunnel? Because that's what Kenyans want to know.
Yeah. So the issue of 2.75% could bring some light in terms of increasing monies available for providing health.
Yeah.
But the problem is, we still have challenges with transparency, at the NHIF.
Yes.
Which is the national insurance provider.
Yeah.
Issues around providing the information Kenyans need, on understanding how money is being spent, our contributions are being spent on different schemes, right? There's just a big challenge with transparency. the need for reforms at the NHIF that enable Kenyans to track, even on a day-to-day basis, how money is being spent, how much money is available, how is that money being pooled? Because the thing with insurance is to have money together and pool it and spread the risk, so that those who are not able to contribute can also have access to it, because they're benefiting from those who are able to contribute. You know, and so the national health insurance is so critical. But if we're going to put in more money into NHIF, we need to reform NHIF. We need to make NHIF transparent. As a Kenyan who contributes, I need to know how that money is being spent. That information is not available. So before those reforms are made and the institution becomes transparent, and it's required to be transparent, by the way, by our constitution and other laws. So before that happens, I don't think adding in more money on this 2.75% would be a good thing, because we still don't know where, how the money is used. We don't have that information. So it is good to increase it, but not at the point where we are.
All right. Thank you so much, Dr. Rose Oronje, who is the head of the AFIDEP offices here in the country. We will continue this conversation. This is not the end, because there's so much that you touched on that maybe we need another day to discuss all this. But thank you so much for your contribution.
Thank you.
We want to take a short break. We'll be back with more updates.